if you don't count people, they don't count. So if you don't collect socio-demographic data, then you really can't offer quality care.
And today our focus is on health equity through our use of socio-demographic data collection as part of health equality everywhere.
We at the LHIN are required to provide health care services to the community, so we need to be mindful of who is in our community and how we can best serve them. So providing services the same way across the geography to all people in the same manner really is not best serving those individuals who perhaps are in vulnerable areas. Those are the individuals that we really need to pay attention to, because they're the people that are most in need, and yet we're not meeting the need. And that's why health equity is so important.
You are clearly committed to learning and talking about health equity and are willing to invest your day to do so. In turn, the Mississauga Halton LHIN is committed to ensuring you have the tools and the opportunity to build health equity capacity with your organization.
I welcome all of you here as we embark on an exciting day of learning and knowledge exchange which will enhance services and enrich our community.
And anybody who retreats from asking simple questions about people's living circumstances, people's earnings, and all of the other socio-demographic questions, you can't give good care if you don't know that information, and you can't set up equitable care, which is good quality care, if you don't know this information.
We still have a huge segment of our population right across them, whether it's visible, invisible minorities, whether it's abilities, disabilities, whether it's mental health, whether it's age, whether it's seniors, whether it's newcomers, that are still not accessing programs and services.
What was strived for at Nucleus, though, was to ensure that equity is embedded in the organization so that it becomes one of our core values.
The other challenge that we have is to convince everybody in this room and anybody who works in an agency that you are competent people to use data. Yeah. And that there's such we've created a culture that it's the researcher that does this. It's the number person in your organization that does this. We got to get out of that and make that accountability and responsibility onto everyone in this room.
Be careful how you judge things, because we're human, and thus do not jump to conclusions. Data is data. It's the truth in a certain way, but what you do with it is very important.
What we actually have are the people with the highest needs accessing the fewest services. To me, that just paints a picture in my mind of an inefficient system. And so looking at equity and health equity as a way to drive efficiency and quality forward, to me, is really exciting. And the way to do that is to look at the data that we collect and how we're using it.
This process takes time, and small steps and small initiatives can help the data collection grow in Halton and get better in Halton.
Which ones of those are already done? So where are the apples? Those kind of, where you've already reached, or organizations are already reaching a really high level, and where around disabilities, language and gender, where organizations, the organizations in the Mississauga Halton LHIN, where there is improvement needed.
One of the ways in which the Mississauga Halton LHIN could move forward on socio-demographic data collection is to work with non-health sectoral partners. So for instance, the settlement services are a huge partner to health integration and health inequities, and they could really be a strong partner in this work.
But data collection is not only for newcomers or families from different walks of life. It's for everybody who resides in Peel and Halton.
And I'm actually really quite sincerely and authentically excited about the story that data can tell. Thank you.